Hi, and welcome to the Luke's House Health Literacy Series. This is part one, entitled, What is Health Literacy? In part one, we will discuss the question, you guessed it, what is health literacy? To get started, let's watch this video from the American Academy of Physicians, which illustrates the topic of health literacy by introducing us to some real patients and letting us hear about their experiences. After the video, pause and take a moment to think about the video. Does anything stand out to you? Are you surprised by anything in the video? And keep your thoughts on the video in mind as we discuss the definition of health literacy.
Average Americans are struggling with modern health care. It's hard to be a patient these days. What's it like to be a patient? What challenges do they face? I want you to meet some people. They'll show us just how complex and overwhelming health care can be.
Well, I'm a kidney transplant. I've had the transplant for about 15 and a half years, but I've been sick forever. Okay, well, I take baby aspirin, that's something new, cyclosporin, prednisone.
And when I make the doctor's appointments, I have to be sure that it doesn't interfere with his doctor's appointments, my doctor's appointments, or their doctor's appointment.
So you don't like to go to the hospital where they give you a lot of papers to fill out?
Paperwork to fill out.
Paperwork.
Yes,
Why is that?
because I can't read that good.
Because you can't read that well. What does it feel like when somebody hands you a lot of paperwork and you can't read?
I feel like you're in another country.
Vitamin D, Nexium, Norvasc, Celestid, Estratest.
When you enter a doctor's office, the first thing, and your first time patient there, they're going to give you a clipboard. Sometimes that is very discouraging for a patient who cannot read.
Lipitor, Paxil, Darvocet, Vitamin E.
If I'm really embarrassed or confused or worried about things around me or worried about my child being all upset, I would not be able to read things I normally would read every day.
You know, some of the words that the angiogram, plasty, and all of that. What is that? Several things or one thing, or it's just a language that I'm not familiar with.
If the patient was transferred to that facility and to any and all insurance companies or other third parties paying or obligated to pay, this is not making any sense.
Tums, Tegretol, Tenormin, sodium bicarb, Cardera.
Do you have any idea what a normal blood pressure is?
No.
Any idea?
No. It's normal?
No, it's not normal. It's high. Have you or anyone ever had to sign a consent form?
Yes. I have hereby, I don't know.
Okay. Authorized.
Authorized.
Miacalcin spray, Nystatin, Aricept, Lasix, Ambien, Imodium when you need it, and vitamin D. I believe that's it.
See, you know these people. And even though they represent all education and reading levels, they have one thing in common: low health literacy. It's so easy to make harmful and costly medical mistakes. Just listen to what they have to teach us.
So what you do, you come out of that room, that examination room, with this intelligent woman or man, thinking, God, I hope I don't make a mistake with my medicine, because I did not understand anything he or she said to me.
When your children have fever, what do you usually give them?
Motrin or Tylenol. Normally Motrin, because that's what my doctor recommended.
How old is your daughter?
She is 4.
She's 4. Okay.
I would give her the 4 to 5, a tablespoon and a half.
So you give her a tablespoon and a half. Can you find where it tells you how many you take? The dosage?
Three a day?
Take 3 to 2 milliliters. And there's something I want to point out. I don't actually read this because I know what it says now. So if I had to sound it out, if it wasn't for I knew it, because I've heard it so many times, I would not be able to read that.
Okay.
Every 3 to 4 hours as needed for pain.
Okay. What's a milliliter?
I don't know.
The medication that was given to her was not explained. Well, we didn't use it.
In fact, she ran out of her high blood pressure medicine, so she didn't take it. She didn't call me to tell me to fill it. So finally I found out that she had not been taking it. I said, Mother, you can't do that. You have to keep taking that high blood pressure medicine.
And then it says discontinue.
Yes.
What does that mean?
I don't know.
How many times do you take these thyroid pills?
Once a day.
Okay. Do you take one of each of these?
Mm-hmm.
Okay, so you take 2 thyroid pills.
No, I take one. I more likely got them messed up when I got refilled.
And then, are these stickers helpful?
Nope, don't even look at them.
Don't even look at them.
Okay. And what do you take that medicine for?
I don't know what it's for.
Okay.
He just puts me on stuff and he tells me when I have it. I just take it.
Low health literacy is catastrophic to patients, their families, and to our healthcare system. Millions of Americans struggle needlessly. Their misunderstanding leads to medical mistakes. These mistakes lead to hospitalizations that we could avoid. Simplifying material alone will not solve the problem. Funding is needed for health literacy research and demonstration projects to identify what works. This problem is costing America a lot of money, but it is a problem we can do something about. As we address healthcare quality and cost, we cannot overlook low health literacy. We must do something now.
Let's consider this definition of health literacy endorsed by the Department of Health and Human Services in the Healthy People 2010 report. Health literacy, the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. Any thoughts on that definition? This original concept of health literacy is based solely on the patient's abilities. The onus is entirely on the patient to understand health information, and any breakdown in that process therefore falls on the patient and implies that they are simply not capable of understanding or managing their care. Right? Well, a report from the Institute of Medicine in 2004 showed that 90 million adults have trouble understanding and acting on health information. It's a really big number, which makes it pretty clear that shrugging our shoulders and blaming the patient is not going to cut it. The flip side of the coin started to come into play as the capacity of the provider and the healthcare system to present health information clearly and understandably was recognized as equally, if not more important, in contributing to health literacy. Additionally, careful analysis of the demands placed on the patients by providers and the healthcare system began to be incorporated as a factor impacting health literacy. In fact, Healthy People and the Joint Commission recognized this. The Joint Commission stated that patients must be given information they understand, and Healthy People 2010 and 2020 identified using plain language materials as an important goal in improving health literacy. Let's break down the concept of demands placed on the patients a little more. What are we talking about when we say expectations of the patient? This table from Literacy and Health in America shows examples of different kinds of health activities and what tasks the patient must navigate in order to successfully complete them. What kinds of demands are being placed on the patient? And what is the capacity of the health system to facilitate their completion? Bearing in mind that to be considered, quote, health literate, a patient must be able to successfully manage all of these steps. Let's take disease prevention for example. The patient should be taking preventative measures and engaging in early detection. That's the goal here. They do so by using materials provided by the healthcare system in the form of news alerts on TV, radio, newspapers that the patient must be able to access, postings for inoculations and screenings, and letters regarding test results with graphs and charts that the patient must be able to understand. The patient must then determine their risk, engage in screening or diagnostic tests, which may be far from home, expensive, during work hours, and attend follow-up appointments as well. Pause the video and take a moment to see if you can identify any possible barriers that might prevent patients from accomplishing any of the tasks in these examples. So hopefully we all agree that a slightly broader definition of health literacy is in order. Health literacy must incorporate not only a patient's ability to obtain, understand, and act on health information, but a provider's capacity to communicate clearly, educate about health, and empower their patients, and a health system's capacity to facilitate access to health care, all while having realistic expectations of patients. In a presentation published by the Minnesota Health Literacy Partnership, they state something that I hope to be true in this case as well. You will see throughout the presentation today that issues with health literacy are less reflective of the function of individual patients, but more a reflection of the system that serves us all. So in this short video, we discussed the definition of health literacy. Up next, in part 2, we answer the question, why should we care? Great job today. See you next time.